name's John Gradley, and I will be presenting this PowerPoint. Today we're going to be talking about Ebola, the media evasive but deadly disease. So to start off, we're going to talk a little bit about the background. As you can see, Ebola was discovered in 1976 off the coast of the Ebola River in what is now known as the Democratic Republic of Congo. Since its initial discovery, Ebola has spread to now encompass many more countries within Africa and around the world. Although scientists do not know exactly where the Ebola virus started, they believe that it originated from animals. Of these animals, the most closely related that they think that it originated from is bats and monkeys. There are 5 different strains of the Ebola virus, as you can see in the slide deck. They are given these names from where the areas of which they were discovered. The first of these was the Zaire Ebola virus, which was discovered in 1976. The Taj Forest Ebola virus was formerly known as the Coast of Ivory Ebola virus. The largest multi-country outbreak that has happened to date happened between 2014 and 2016. So now we're going to talk a little bit about the transmission of the Ebola virus. The transmission of the Ebola virus can happen in a multitude of ways. The most common is through human-to-human contact with bodily fluids of an infected person. This includes their blood, saliva, and other body fluids. Along with this, healthcare workers have a high risk of contracting Ebola if working with an Ebola-positive patient, and places where infection control measures are not as practiced as much as they should be. Ebola can spread through pregnant women that are affected onto their baby in a few different ways. Although the placenta is a natural barrier from passing on of a disease, the baby is still exposed in a bunch of other ways to other body fluids. Ebola can also be spread through eating of infected animals, which is customary in some parts of the world. A big issue that caused needless infections of the virus during 2014 and 2016 outbreak was that of bathing the dead, which is a customary practice in parts of Africa. And although it is a cultural and customary practice, the disease can be passed on to uninfected family members. But with that all being said, we can take some solace in knowing that Ebola cannot be spread through water or air. So now we're going to talk about some symptoms. So symptoms of Ebola can develop from anywhere from 2 to 21 days, although most symptoms appear between 8 to 10 days. It is important to remember that asymptomatic people cannot spread the disease. So what to look for in Ebola? At first, Ebola may show signs that are similar to malaria, typhoid, and other diseases. This causes issues with diagnosing patients early and requires laboratory testing to identify infected patients. Some important symptoms to remember when discussing Ebola are abdominal pain, altered mental status, organ failure, and bleeding. Lastly, if a patient were to recover from Ebola, they will have antibodies to the virus that can last up to 10 years. Going on to diagnosis. In the past, Ebola was diagnosed using laboratory tests that would detect for the genetic material of the virus. The old test required highly trained technicians that worked in well-equipped laboratories that were far away from the outbreak zones. This caused issues because it meant that the patients and healthcare workers had to wait for days for the test results. Although, in the new tests, the waiting time has shrunk to just hours. The new method of testing is able to be performed rapidly and close to transmission zones. The machine that they are using is called Gene Expert, which is widely used to diagnose other infections such as tuberculosis. Although, as you know, symptoms can take a while to show, thus patients that test negative for Ebola need to be repeated after 72 hours. If caught early, basic life-saving interventions such as fluid resuscitation, oxygen therapy, medication for blood pressure, and to reduce vomiting and diarrhea. Also, medication to manage fever and pain are helpful to improve the chances of survival in Ebola outbreaks. Prevention and control. These prevention and control measures should help reduce the transmission of the virus. For those in the countries that Ebola is a big issue, these are very important. Making sure that animal products are cooked thoroughly before consuming them is important to remember. Wearing all appropriate protective equipment given the situation that you are in is also important. Washing hands, as every part of infection control, is important to remember with Ebola. Sex is a big part of life, but safe practice, just as in every day, is especially important when it comes to Ebola. Even though males may not be showing symptoms, it is best that they follow the measures and practice safe sex for at least 12 months past recovering from Ebola. The reason for this is that they can still pass on Ebola through their semen up to 12 months after recovering from Ebola. Although a cultural issue, safe burial practice and washing of the body is crucial to prevent the spread of Ebola. Making sure that those that have been in contact with infected patients and separating the healthy from the sick also helps to prevent unnecessary infections. In the 2014-2016 epidemic that you're probably familiar with, 11 people were treated for Ebola in the United States, among countless other individuals that were treated as suspected Ebola patients. In 2014, on the 30th of September, the first case of travel-associated Ebola was confirmed in the United States from a man in Dallas, Texas. Unfortunately, this patient died, and 2 of the healthcare workers that cared for him tested positive for Ebola, although they both recovered. 7 other people were cared for in the United States after they were exposed to the virus and became ill when they were working in West Africa. These 7 were transported from West Africa to hospitals in the United States. Only 1 of these patients died. As you may see, a trend of hospital workers and those that are treating patients are most likely to be affected with Ebola virus and are at a higher risk than other people. Another big outbreak that happened in the United States was in October 23rd, 2014 in New York City. A medical aid worker who was in Guinea volunteering was hospitalized with the suspected Ebola. He was confirmed with Ebola by the CDC the next day, but made a full recovery. Since these outbreaks on U.S. soil, the United States has enhanced its screening barriers for travelers coming from Ebola-positive countries, such as Guinea, Liberia, Sierra Leone, and other countries that border them. As another response, the United States trained more than 6,500 people in live events to go through drills in case of an Ebola-positive patient. A lot of major hospital systems, especially on the East Coast, put a huge emphasis on this training. The auto laboratory capacity was expanded in Guinea, Liberia, and Sierra Leone, adding 24 laboratories by the end of 2015 that were able to test for Ebola. If you take anything away from this presentation, remember that although the largest outbreak of Ebola happened from 2014 to 2016, there is still an ongoing battle against the disease, with little signs of stopping anytime soon. A bunch of countries worldwide have been affected by Ebola, although most of the cases have happened in Africa, there have been a bunch of other countries affected outside of Africa. With that in mind, the reason behind this exposure outside of Africa can most likely be due to the aid workers that are working within the affected parts of Africa. And as a result of being exposed, the aid workers were infected with Ebola. To date, there have been over 28,000 cases of Ebola and over 11,000 deaths reported. A lot of focus is on the Ebola virus and how it kills so many people and affects so many more. Although very few talk about the impact on the economy and how that makes things worse. As you can see above, in just the 3 countries listed, they lost $2.2 billion in gross domestic product in only 2015. Not to mention the effect the virus has on these countries' ability to feed their people and trade with neighboring countries, which might help for them to regain any of the money they lost. These areas need to be addressed in order for these countries to recover and be able to afford to fight the virus and feed their people. So let's talk a little bit about the impact of Ebola on the healthcare system. As you can see here, Ebola is not only a disease that affects people, but it also affects the healthcare system in terms of the healthcare infrastructure. Since healthcare workers are the highest risk of infection, and since they are crucial in the treatment of not only Ebola, but other diseases, it is important to protect these healthcare workers and the healthcare infrastructure so that diseases don't kill people while Ebola is going on. And as you can see in this slide, there's some crucial aspects in terms of how many healthcare workers were infected between 2014 and 2016 in Guinea, Liberia, and Sierra Leone, as well as how many percentage of each of those healthcare workers broke down were also infected. So now covering another impact of the Ebola virus, but not just the virus, is the impact on children. The impact on the children is important because children are the future of the country. Their education is important because without this education, the country's future is going to be struggling even more than it already is. Not to mention that the orphan rate is high in just the 2014 and 2016 outbreak, leaving the country trying to figure out what to do with these kids after the epidemic has passed. Along with immunizations and vaccination programs that are important for the health of the children, with or without the Ebola outbreak, being sacrificed because of the outbreak. And as you can see here, a big number, 17,300 children were orphaned during the Ebola outbreak. So what's going on with Ebola nowadays? So some current news on Ebola virus happened with the latest outbreak occurring on the 1st of August 2018. This happened in Kivu province of Congo. According to the information from the Medicine Without Borders, there has been a total of over 1,000 people presenting symptoms of the disease since the outbreak started. Among those that were infected, 944 people tested positive for Ebola, and 629 died from the virus. Okay, so now we're going to look at some of the beliefs in Africa, in particular in the Congo. So, after the incident in the Congo in 2018, the researchers of the North Kivu province conducted a survey where they interviewed 961 adults. The results of this survey were very disturbing. More than 25% of the respondents believed that Ebola doesn't even exist, and 33 believed that the outbreak was fabricated by the authorities for financial gains or to get rid of the political opposition. 36% said that they believed it was fabricated to destabilize the region, most likely for what I just said. And less than 32% of respondents believed that local authorities could be trusted, which causes issues with trying to prevent the spread of the disease, because if people don't trust their government, they're less likely to do what they say during an outbreak to limit infection. So going into why it's so hard to treat. As talked about earlier, the fact that people do not trust their government is a huge barrier into why Ebola is so hard to treat. Another reason that Ebola outbreak is so hard to treat is because in infected countries such as Congo, they face a number of issues on a regular basis that they have to focus on. Also, as we talked about earlier, medical personnel shortages causes issues in treating the Ebola epidemic. Another big thing is the use of contaminated needles or syringes when treating patients. According to the CDC, during the first outbreak in Zaire, nurses used about 5 syringes for 300 to 600 patients daily. This caused a lot of cross-contamination, along with improper nursing techniques. It led to a lot of unnecessary infected people. So now moving into the media portrayal on Ebola. A very important topic that is rarely discussed is the media's portrayal on Ebola and how that affects what people believe and what people see. The US focuses on personal stories as opposed to the rest of the world, which just focuses on facts and figures, getting less of an emotional response than the United States does. The United States also uses actual patient testimonies and certain messages to help create hysteria among the residents of the United States, especially amongst those that are only watching in the media and not educated about the truth of what Ebola really does. The rest of the world, although not much better, focuses on cultural aspects and doesn't cover the epidemic as much. Although, with this all being said, no media outlet covers it to the threat level it actually is. The general population didn't even know about Ebola much before 2014 and doesn't really know how big a problem it still is today. So, some policy recommendations that me and my group have come up with is to help with prevention and education campaigns. With these, to help these populations know more about the disease and measure and to prevent its spread. Another policy is to have Western trained medical personnel come and train local healthcare workers and volunteers to help try and contain the disease. Something that is very important that we need to combat is the mistrust of their own government. This mistrust will not only cause needless infections, but it could cause more problems down the road. A big push for this is to help the governments do what they need to do to get their trust, such as the national government that the people do trust, coming in and taking lead to help revamp the local government. So some policy recommendations continued. As we've seen earlier, it's important to have an infrastructure and stability of the countries that are infected by Ebola, so that these countries have a country to run when the Ebola outbreak is dealt with. We must not forget that even though the Ebola outbreak is deadly and extremely important to focus on, we cannot let other things go by the wayside during the outbreaks. People still need food and need financial stability. Kids still need an education, immunizations, vaccinations, and a place to live. Along with this, other diseases such as HIV, tuberculosis, and malaria, need to be monitored and contained during these outbreaks. Infrastructure should be put into place to help make sure these areas are not forgotten during outbreaks. So lastly, this is just a bunch of our references and whatnot. Feel free, if you have any questions, now's the time to ask them. And I hope you enjoyed this presentation as much as I enjoyed giving it.